Je vais prendre ta douleur.
We still do not know how acute pain really turns chronic, and a lot of people are studying this now. And one important factor is changes in the brain, maladaptive neuroplasticity, changes that lead to a stronger processing of pain, or that the experience of pain gets connected with anxiety, depression, stress, and these brain circuits can then overlap and cause a lot of suffering to the patients. And some recent data show that learning and memory processes interact with those changes in the brain. So people, for example, in the course of a development from acute to chronic pain, they tend to appreciate pain relief or pain reduction more than other kinds of positive events, for example, food or drink or something like that, or nice, pleasant activities. So they learn to no longer appreciate those and focus their attention very much on the pain. And this shift from more positive, alternative pain, unrelated behaviors to pain can be something that really moves the chronicity process. Another aspect of the learning is that fear learning is very important. People learn to fear pain, fear movement. That leads to catastrophic thinking, and then also to more inactivity, disability, and this can lead to a vicious cycle. And so both this increasing aversiveness of the pain and the lack of positive experiences have to be addressed in treatment. And two things that are increasing that is if people experience stress, or if they had stress already early on in their life, that can increase it, or anxiety and depression can also be factors that play a role. One important aspect in understanding chronicity would also be to better understand resilience. So why some people do not develop chronic pain, and this is also something that is slowly evolving, where we can, for example, study people who just do not experience pain because they have some genetic problems, or for example, people without phantom limb pain after an amputation. So what protects them compared to those who develop pain? So that is a very interesting topic in this context as well. And we think that memory processes are very important for this also, so that if you have experienced pain before an amputation, you are more likely to develop it afterwards. And important consequence for treatment of this would be that you would, in chronic pain, or also on the way to chronic pain, in people who are at danger of developing chronic pain, maybe stay away from analgesic medication and rather focus on altering the learning processes, the brain plasticity. This could be using behavioral training, or medications that change learning and memory processes, or brain plasticity, or a combination of the two could also be very interesting.